I'd like to welcome Joanne Giardini-Russell to the program. She is visiting with us from Michigan, where she is the owner of Boomer Health Group. Joanne and her company specialize in Medicare product selection across the country. Welcome, Joanne.
Hi, David. Thank you for having me here.
Glad to have you. So I know you put a lot of focus and attention. It's pretty much what you live and breathe 24/7 on Medicare. Okay. So for those people who are not as familiar with Medicare as you are, give us the quick 50,000-foot view of Medicare, and we'll get into some detail.
Yeah, you're right. That's exactly all we do. So 24/7, that's all we're doing. Medicare is strictly and only the national health care system designed for age 65 and over, or special people. There are 8 million on disability that are given Medicare benefits. But it's a very specialized arena of the health care.
Okay.
But that's all it is. It's health care.
Okay. And so eligibility primarily at 65.
Right.
Okay. And so let's speak to eligibility. Do you have to have any type of work history? Is it like Social Security to get, 40 quarters or anything like that?
You've got a small window of related ability to the 40 quarters, but generically, no. When you turn 65, most people are qualifying either on a spouse's record, but you're coming up to 65. And so it's funny, we really focus on eligibility as age 65. It just means you're eligible. It doesn't mean you have to go that route. It doesn't mean you shouldn't. There's so much misinformation in our world about that you need to have Medicare at 65, and there's the panic and there's penalties and things like that. It's like, no, it just means you're eligible, and make a qualified assessment of, should I do this? Okay. And that's where we come in.
Okay. So conveniently for you in the audience, I'm not an expert on Medicare, right. So I'm going to ask you the questions that they would ask.
Yeah.
So, so let's fast forward a few years. I turned 65. I'm still working. I like what I'm doing. I like my job. I've got health insurance through work. Do I need to do anything about Medicare?
There's a lot of you folks doing that. So the workforce is getting older, right? We're seeing people at 66, 67, 72. I've had an 82-year-old finally retire. Those people just need to make an assessment of, I'm coming up to 65. Our normal questions are you contributing to a health savings account? If you're doing that, we're going to tell you do not even sign up for Part A of Medicare, which really? Most people don't catch. We have CPAs miss it, financial folks miss this. Don't do that, because it's not a qualified high deductible plan to continue funding that HSA. So our question is, hey, do you love your HSA? Are you enjoying, you do like the benefits of that? Yes. Are you healthy? How's your work coverage? How much are you paying for your work coverage?
Okay.
What is your work coverage? What are the deductibles? So that's our assessment, and it becomes a little logical to us, kind of a T-chart. Medicare on one side, group insurance on the other side. So there's a whole bunch of parameters, but it's just not as simple as, hey, I'm eligible, jump. You really need to look at it, dig into
not
the details.
Everyone should sign up for Medicare Part A, which is the hospitalization.
Right, that's hospitalization. There's two components of hospitalization, and then Part B is more medical services, doctors, things like that. No, and it's a misnomer. I love to walk into groups and say, is Part A mandatory? 50% at least of the hands go up, and that's not true. So that's our first, and they realize, like, whoa. No, because there's certain people that shouldn't do that. We catch 70-year-olds having signed up at age 65 for Part A, but they've been contributing to that HSA for 4 or 5 years. We're not the IRS, but you're not supposed to do that.
I see.
Yeah.
So you don't lose anything if you're continuing to work, say you work to 70, I'm not missing out on something by not signing up for A?
Not at all.
Wow.
Not at all. Well, I should say you are missing a little bit of hospitalization coverage, should you be, but you do have your group plan.
Okay.
So if the HSA is more important to you than that little piece of coverage, it is going to be a trade-off. However, if you're not contributing, we often will say, of course, go sign up for Part A. You have something, and then call us when you need Part B.
So let's take the HSA out of the equation and just look at so if I've got the group health and I don't sign up for A at 65 because I'm continuing to work and I've got my health insurance through work and it's a good plan and it's not, there's no problems.
Right.
Will my group plan penalize me for not having signed up for Medicare Part A? Because they love subrogation. They love to say, oh, you've got other insurance. No problem there either?
Right. We do direct them back to the group HR folks, and hopefully they have a good answer for you.
Okay.
But that goes down to the plan documents. It typically isn't going to hurt somebody for signing up for the Part A. So that's okay.
So let's say then these are great, I'm getting all my Medicare questions answered. Yeah. So let's say then I decide to retire at 70. I'm going to come off of my group plan.
Right.
at that point then, if I haven't signed up for Medicare, I can sign up for Medicare at that time? Is that kind of like a qualifying event?
You can, it's right, it's a special election period. So that's where it becomes really important to come back to someone like us that can walk you through step by step. A lot of agents out there will just say, well, go sign up for Part B and come back and we'll help you with a product. We don't do that. We have these tutorials built that just says, here's what you need, here's the steps you need to take, here's the forms you need to take into you have to go back to your HR and get some verification that you've had coverage back to 65 years old so that you don't get that famous Medicare penalty that is out there. And if you are penalized with Medicare, that penalty will take you forever. You have to die to get rid of your penalty. So yeah, so it is significant. So we have to walk you through the proper steps, but you have a qualifying event, you just sign up for your Medicare, and that becomes your health care.
Okay,
and we
so
kind of pair it.
I can leave the group health behind. I can go on A and B, the hospital and, of course, the doctors, and then any other options I can weigh at that point.
Correct, because that's 80% of your health care. Exactly. So you know where you're going navigationally, right? A and B are 80% of your health care at that point. Then you have a 20% number that's not capped.
Okay.
So that's where it's really important to again, get that filler product. And then we dive into one of two products. And then how do you fill that? That's a whole other conversation.
Well, and there's a lot of discussion in the financial planning world about the cost of health care in retirement. And some of the numbers are staggering. We hear numbers like $200,000 to $300,000. And we're not talking about long-term home care, custodial care. We're talking about health care. That comes from, I'm going to go out on a limb here, to these deductibles and copays and all of those things that somebody might experience because Medicare only covers the 80% unless you've picked up some sort of supplement or gone to an Advantage plan. Is that right?
There's two times where we actually get real technical, and I think you need to. The Medicare handbook, it says on page 5, just go start looking at that page, you have two options. And they call them supplements. We don't call them supplements. We call one for Medigap. We call one Medicare Advantage.
Okay.
And they operate like they're apples and oranges. So that's a lot of our discussion. Okay. Advantage, they do have a lot of copays, deductibles, and things like that that your out-of-pocket costs. But it does kind of dovetail with long-term care or lack thereof for skilled nursing, things like that, which is a whole other conversation.
Whole other topic.
Yeah.
So with those primary two choices, is this something then that people will elect periodically? There seems to be a lot of fuss around the fall each year. What's going on? Is that an enrollment period? What is that?
Yeah, the fall, unfortunately for us, because we do a lot of Medigap contracts, which is every year, every day of the year. It's just like a home or an auto policy. We can write that in January, February, March, doesn't matter. So it's kind of frustrating to us that October thing sort of exists. However, it does give people the ability to, if they have elected a Medicare Advantage plan, and they've learned that it's really not what they thought it was going to be. The fine details kind of happened and they weren't aware of things. They have the ability to go back to traditional Medicare and pair it with the Medigap. Or the other thing is that we are constantly looking at drug plans in the fall, which is great because the question we get a lot is, well, what if I'm taking ABC drug in next June? Can I get a different drug plan that handles it better? Well, you can, but we don't know what you're taking maybe. Okay. And then when you have the time, you can annually adjust that. So
this is an annual adjustment period in October?
It's an annual election period where you can change a couple of things. It's just not, a lot of people think that all you can do is touching and changing your Medicare is the fall, and that's not true. So call in January and March and ask your agent if you can do things that make changes.
So you could change your Medicare supplement, or you call it a Medigap.
Your Medicare Advantage plan. Yeah, your Medicare supplement, yes. Your Medigap can be changed in March or April. If you get a rate increase in April, call your agent. Don't wait till October.
I see. So the Medicare supplement, Medicare Gap, same thing?
Medigap is a true supplement.
Okay.
We just call Medigap Medicare Advantage to keep that. People don't know what they have.
Yeah, it gets a little confusing for people. I mean, it's just all these different pieces and parts, and with the Medicare Advantage, that's where you're basically going into some sort of capitated or contractual deal where all of your Medicare is kind of pulled together, and it's, like an HMO.
Correct. It's an HMO or PPO, and a lot of people don't realize that it's a privatized. You are not truly enrolled in original Medicare. The government has sort of moved you over to a carrier, and if you can live with the carrier rules, you're fine. But you have to abide by networks. You have different things that they're going to require you to do. Maybe you only can get 2 pain shots this year versus 4. That original Medicare would. So it's really important to understand your possible lack of control. And that's what happens is people get in there and they realize this isn't what I kind of thought it was going to be. Nobody really showed me the fine details, so they kind of went out. So very different, like I said, different programs.
It's a lot to